My name is Alex Loach. I'm a physiotherapist at Calgary Core Physiotherapy. I've been here for about 10 years now, and I graduated from University of Alberta in 2013. My clinical specialties include running gait assessment and vestibular therapy, as well as your typical musculoskeletal neck, back, knee, hip, ankle injuries. As a runner myself, I end up seeing a lot of runners in clinic. I feel that it helps me knowing how some programming works, some training works specific to running, as well as what proper gait is. And so we bring people in, stick them on the treadmill, slow motion video, and we're trying to tell, is their gait supported? Is this something that's causing injury, contributing to a problem, and getting them better from there, as well as the typical physiotherapy assessment and treatment based on what they're presenting as. I was one of the lucky ones that knew I wanted to be a physio from a pretty young age, knowing I wasn't going to make it as an NHL player. So having injuries myself throughout hockey career, if you will, I had to do some physiotherapy myself, and just seeing how much knowledge they had with many different areas, not just the things I was coming in with, finding muscle imbalances, prevention and correcting maybe deeper issues. And so I followed that trajectory pretty young and got to do some sports medicine, kinesiology along the way. And then with strength training in university, and then now running in a post-grad, taking that in and trying to help people with their outside of work careers, athletic careers as well. I'm pretty lucky that work doesn't feel like work most of the time, because we're usually working with people, and in my case, working with runners a lot, or people with conditions that I've had as well, vestibular conditions, dizziness conditions, neck, back pain from the gym, that sort of thing. It just feels like I'm kind of helping people through what I've been through as well, and getting them back to the fun stuff. And like I said, the strength training, the running, other sports, hockey, that sort of thing. We're lucky at Calgary Core Physio, we get to do one-on-one treatment. So the full 30 minutes or 60 minutes is spent with the patient. And so we can get to know people a little bit better, both them and their injuries, as well as their goals. And so culture around that is a little more kind of goal-focused, patient-focused, and we get to know each person to help them with their issues. Having a group that has specifically come to a clinic that has one-on-one and more, treatment-focused based care is great. We kind of all have the same goals in helping patients, so we can bounce ideas off each other. If one does a course, we get to talk about that. They can bring information to all of us, and sharing ideas about treatment for patients or difficult cases, and just knowing you have a bit of a team behind you is great to have. Given that I see a lot of different types of patients, from runners to dizziness conditions to neck, back pain, anything on the body, my perfect patient is probably just someone who's coming engaged. They're probably here because they want to get better, and as long as they can play an active role in their process, which most people are very good about, they have their goal in mind and they're trying to get there. That as long as we're working together to get them better, then usually most people are quite successful. I think a lot of patients can be a bit misled, whether it's information from the internet or other practitioners, about kind of guessing what type of activity to continue. Some come in overdoing it, some come in underdoing it. And so having a physio that can help not only with, okay, here's what you need to do physio-wise and treatment-wise, here's what you should be doing hobby and activity-wise as well. Just having more guidance with that is probably a big differentiator in successful outcomes for people. I remember a particular patient that came in suffering from pretty extreme dizziness. And typically when dizziness starts, it's quite debilitating, whether that's nausea, inability to do day-to-day tasks, just being stuck in bed for at least a couple days. There's also a big concern about what's going on. They think something very severe is happening given their symptoms. So being able to educate people, diagnose them, and then subsequently treat them. And in this case, it was benign positional vertigo. So treatment was relatively straightforward and quite quick. To see them walk out with their symptoms already improving is a pretty big moment, obviously for them and for me as well. And that a big part of the drive as a physio is you want to have those moments that all of a sudden, maybe it's over the course of a month or two in other conditions, but relatively suddenly, that person's now able to function again. I think if you're someone struggling with a chronic injury or an injury that's been a bit stubborn, if you come give us the opportunity, I think we can really help you.